problems with predictions, okay? First of all, a lot of the predictions that you heard said, okay, there's going to be 1 million, 2 million people die of this thing. This is based on one group's work, Ferguson's work from the Imperial College of London, okay? These people are wrong. They've been wrong before. They're wrong now. Why? First of all, as an example, do you remember mad cow disease? These are the same people said, oh my God, we're going to have to slaughter the entire U.S. herd. It's going to be everywhere. Okay. All models make assumptions. Their assumptions are not correct, right? And it hasn't held up. Right now, I'm not saying it's not nothing. Look, we've lost a lot of people. Of course, 130,000, in the United States, right? Worldwide, a lot more. But it's not to the level of the numbers that they predicted because people change their behavior. The risk factors could vary. How it happens to hit people, what parts of the country. We are not New York. New York is a very different place with the subway systems, the density of the population, how people work there, how people live there, right? These things change. Next, another reason. Almost half the deaths have occurred in nursing homes, right? So this skews the data tremendously because the vast majority of people don't live in nursing homes, right? There was a terrible mistake back in New York where the governor of New York had people saying, okay, you're sick, you're partially sick, you're starting to recover, we're going to get you back in your nursing homes. The worst thing ever, right? Because you're exposing the most vulnerable back to this virus, okay? Probably the best models that look at prediction come from the Reich Lab, which has a COVID-19 forecast hub, which combines multiple of these prediction models. So if you're really into this stuff, you really want to look it up, just type this in, Reich Lab COVID-19 Forecast Hub, and you'll get to the webpage, and it'll show you some of the data of how they're looking at it and kind of the data they're trying to use. So what they do is they would throw out some of the predictors of the Imperial College Ferguson stuff and look at other predictors and then combine them and to get a more smooth, reasonable prediction. And I just want to show you something because this is very important to keep in mind, right? So look. Here is a graph that I know looks busy. Just stay with me, right? It just has a point that I want to draw to you. This is deaths per million at 21 days versus days to shutdown. Okay. There is a difference between saying to people, okay, look, I need you to wear a mask. I need you to wash your hands, try to socially distance, versus we're going to shut down the entire country, okay? If you look at this data from different states and different countries, what you would normally expect is the following, that as you go along the line here of days to shut down, meaning you go longer and longer until you decide to shut down, you'd say, okay, if you didn't shut down quickly, if you didn't close your economy quickly, if you didn't do everything right away, you're going to make it so that you're going to have more infections. Well, if that's the case, then over time, this line would go up like this, but it doesn't. This line stays relatively flat. What does that mean? It means that for all the bashing that Sweden gets for not having shut down and for other countries that waited to shut down, it's not exactly like it had a direct correlation going all the way up. I'm not saying that mitigation efforts are useless. They do help, right? When you put on a mask, when you wash your hands, when you socially distance, it lowers risks, right? But when you shut down a country, now it's a different criteria because now you're doing other things that don't have an impact on the infection, right? That's the big distinction. And this is something I feel very strongly about because in one of the books I wrote for the American Medical Association on workability and return to work, we talk about the literature. And there's a lot of this literature that says when you shut things down, when you cause people lose their job, when you have people that are poor and living paycheck to paycheck, and now they have no place to work, all their health indicators get worse. Increased rates of marital violence, divorce, drug use, alcoholism, suicide, all those things get worse. So now you've shut down something that doesn't have any good data for it, and you've increased the risk for other people, right, who are also very vulnerable, okay? Here's another way to look at this. the daily new infections as a percentage. So this is all the different countries, right? And this is the time in weeks. So what you can see is, with all the countries doing all different kinds of things, right? All having different policies, all having different approaches, you see that in general, the trend lines are all about the same. I'm not saying that there's not something to be said for having public policy. What I'm saying is it has to be thought through as to all the implications, not just this infection, but for all the data about whether or not it makes a difference, right? So we do see that when you have influenza, an example, the classic flu, look, it goes up, it goes down. So every year, it goes up a little bit more, it goes up a little bit sooner, a little bit later, right? And this one in coronavirus, which is one I know it's a little hard to see, but you can see like, well, okay, with corona, with all the mitigation we did, made a big difference. But, there is no question that when you do mitigation, it makes a difference. We never did it as much for influenza. Every time we have the flu season, I'd say to all of you, okay, you got to get your flu shot. You've heard it from me ad nauseum for years, and this hasn't changed that message. You still got to get your flu shot, right? And you still need to be more careful. Okay, we weren't as careful, but you know what? Depends on the year. We would lose minimum 30,000, often 60,000 people to influenza every year, right? And this year will probably be a little bit less because of all the mitigation efforts. But these things go on, and there's no data about doing a total shutdown for that.